Hello all, my name is Deepika Nagalingam. I'm currently doing Psychiatric Nursing Mental Health Practitioner program at Eastern Kentucky University. I will be discussing my project proposal on the effectiveness of dialectical behavioral therapy, which is also known as DBT, on adolescents with high risk of suicidal ideation, SI, and self-harm, SH. The risk of suicidal ideation, suicidal attempt, and self-harm has been growing faster among younger population. According to Healthy People 2030, the study done among adolescents aged between 12 till 18, 13.9% of suicide per 100,000 population on 2019 and 14.2% suicide per 100,000 population on 2018 were recorded. DBT with standard treatment would be more effective in reducing risky behavior among young population. It also helps with a maladaptive behavior as well as builds a life worth living. Pavlov's theory of interpersonal relationship related to this intervention, which is DBT, which mostly focus on the therapeutic nurse-to-patient relationship using problem-solving techniques to meet the patient needs. Interpersonal relationship with patient would help build up the trust with the provider. And also, this helps with the self-management practice of the provider. There are 4 phases in this Pavlov theory: orientation, identification, and exploitation, and of course resolution, which is totally related to the DBT treatment plan. I have done some literature studies before starting this project. There were 3 types of literature studies. The level 1 study is a systemic review and meta-analysis of the DBT literatures. Basically, this study was evaluated from the previous database for the clinical studies, which consist of 5 RCTs, 3 CCTs, and 13 pre-post evaluation. As the collective of all these previous studies, the effectiveness of DBT is high on the adolescent with HI and SH. SA. The level 2 was a randomized controlled trial which was done among adolescents aged between 12 and 18 with a history of lifetime suicidal attempt and emotional dysregulation. The total of 173 participants participated in this study. The participants were randomly assigned to the DBT group and the individual group supportive therapy. The treatment duration was 6 months. The treatment completion rate was higher on DBT, which is 75.6%, than the individual group supportive therapy, which is 55.2%. No suicidal attempt was reported, which is 90.3% reported in who received the DBT group, and only 78.9% reported who attended the individual group supportive therapy. The last literature was qualitative study, which would help explore the experience of young population and the parents of DBT service who are receiving the DBT service. The young people reported improvement in the bipolar symptoms, which are emotional dysregulation, increase SI and SA after completing the treatment. In addition to that, the parents reported improvement in the young children life since they started the DBT. Before I start the DBT, I build up my aim for this project proposal. There were 3 aims. One is reduce SI, the second aim was reduce SH behavior, and the third aim was family involvement improves SH and SI behavior in adolescents. The population of this proposal was adolescent aged between 13 till 18 years old with a history of suicidal ideation and self-harm. Parents of the patient were involved in order to increase the effectiveness of the outcome and to improve the support. The inclusion criteria was done in a way of randomized clinical trial based on the patient's prior history of SA and elevated SI in past month, and increased score of PHQ-9. The sample size was only 30 participants and their family. The recruit method was throughout the 12-month project. The mild level managers and the therapists would recruit the patient and their families for the session. Only 30 patients and the family was involved in the study. The nurse would do the PHQ-9 screening to determine the level of suicidal and the self-harm thoughts at the beginning of each session. There were 3 methods done in this proposal. The first step was training the staff, which was done before this plan. Twice a week meeting, which are each 60 minutes to discuss the plan and the process of getting the approval for the internal review board, which is IRB. The step 2 was screening and enrollment. During this implementation plan, weekly 160 minutes to discuss the progress of plan after the implementation. The step 3 was implementation of DBT, which is after the implementation of the DBT. Twice a month for 60 minutes to discuss any issue that arise and to evaluate the follow-up with the patient and the outcome. The length of the DBT session is totally 15 months. The DBT group session will be held at the adolescent unit by the therapist weekly. Family session of DBT would happen once a month for the 3 months. Each session would be 30 minutes long. The outcome and evaluation. The evaluation would be determined at the 12th month. The outcome would be determined based on the aim of the project and making sure the aim was met. Measure or evaluation. The result of this project was measured mostly from the PHQ-9 screening, which is mostly self-reported. If we notice any score 1, 2, or 3, it might require further inquiry. It indicates the patient would be better off dead or having some thoughts of self-harm in some ways. And it also can be measured through the method of self-harm or hospitalization of the patient while attending this session. The other part is to having some interaction with the family to determine how they feel about this DBT session after completing the DBT session, whether their children make any difference after attending the DBT session. The total length of this program is 15 months. The active project with the family and the patient would be only 12 months. Coordination of the project plan is the first 3 months. The first 1 to 2 weeks to recruit patient and the family who are appropriate for this session. The 3rd to 14th week is the active DBT groups, and the 6th month is to evaluate the reduction of suicidal ideation, self-harm in adolescent. The 12th month to determine any suggestion to improve the program or to explore the implementation of DBT skill manage. Thank you so much for watching my video.